Part 14. Diagnosis and treatment of trauma and dermatosis. Gingiological therapies for external injuries and dermatoses are characterized by simplicity of treatment, rapid healing, a short course of treatment, and the absence of side effects. As a result, it is widely accepted and applied. It has shown excellent therapeutic effects clinically. In this part, we are going to show you the symptoms, points, and manipulation of 12 kinds of trauma and dermatosis. Urticaria. Urticaria refers to a kind of allergic disease which is commonly seen in the clinic. It is caused by a disorder of the defensive qi or the invasion of exogenous pathogenic wind heat or wind cold, or an accumulation of heat in the stomach and intestines with further attack of the exogenous pathogenic wind. The main symptoms are itching wheals of various sizes or uneven pimples of red or white color appearing one after another. For treatment, Qu, large intestine 11, Hegu, large intestine 4, Xuehai, spleen 10, Geshu, bladder 17, and Weizhong, bladder 40 are selected with a reducing method. The needles are retained for 30 minutes, puncture once or twice daily. 7 treatments constitute one course. Qu, large intestine 11, the He, C point of the large intestine meridian of the hand Yang Ming, is needled with the reducing method to disperse the pathogenic factors from the exterior. Hegu, large intestine 4, the Yuan source point of the hand Yang Ming meridian, can strengthen the function of Qu, large intestine 11, by dispersing the exogenous pathogenic wind and relieving the exterior symptoms. Xuehai, spleen 10, the point along the spleen meridian of the foot Tai Yin, is the key point in treating blood diseases. It can be used to activate blood circulation, resolve blood stasis, and harmonize the Yin system and dredge collaterals. Geshu, bladder 17, one of the 8 influential points, refers to the blood point, which is good for treating the blood system. In combination with Xuehai, spleen 10, it is more powerful in strengthening the function of activating blood circulation. Weizhong, bladder 40, the He point of the bladder meridian of foot Taiyang. Pricking the point and causing a few drops of blood can suppress heat in the blood system. For the invasion of the exogenous pathogenic wind heat, the symptoms are bright red wheals. Feng Shi, gallbladder 31, is added to disperse heat and wind. For the invasion of the exogenous pathogenic wind cold, the symptoms are manifested by white wheals. Dazui, Du 14, is punctured to expel the cold. For damp heat accumulated in the stomach and intestines, the symptoms which appear are wheals accompanied by nausea, vomiting, abdominal pain, and diarrhea. In Lingquan, spleen 9 should be added to remove dampness of the Tai Yin meridian. For patients with deficiency of qi and blood manifested by lassitude, the wheals are characterized by relapses. Zhou Sanli, stomach 36, is added to regulate functions of the stomach and intestines, to nourish the middle jiao, and to promote qi circulation. Moxibustion is combined after needling. Pishu, bladder 20, is added and punctured 0.5 to 0.8 cun. This is to strengthen the spleen and harmonize the middle jiao and nourish qi and blood. Deep insertion is not advisable to avoid injury to the internal organs. Moxibustion is combined with needling later on. In addition, during the onset of wheals, the plum blossom needle may be used to tap the wheals locally until slight bleeding occurs. This serves to dispel wind, relieve itching, and subside the wheals. Furuncle. Furuncle is an acute infectious disease. It has different names according to its locations, such as pustule on the back, pustule of the fingertip, pustule in the elbow, or pustule on the foot. In the initial stage, there may be a green-like reddish, yellowish, or purplish furuncle or pustule. Its root has the hardness of a nail. Afterwards, there will be redness, swelling, and burning pain, or even suppuration. The initial stage belongs to the superficial syndrome and yang syndrome. The due meridian governs all the yang meridians, so the disease should be treated with points in the due meridian. Treat Shenzhou, due 12, and Lingtai, due 10, the main points, with a strong stimulation and apply the reducing method. Then retain the needles for 20 minutes, or deplete the 2 points. Both methods can be very effective because they can eliminate the fire toxicity and promote qi and blood circulation in the meridians. They are clinically proven points for treating furuncles. Add Hegu, large intestine 4, the yuan source of the meridian of the hand yang ming, to improve the curative effect, as this meridian is full of qi and blood. Reducing it can clear internal heat and relieve toxicity. It is effective for furuncles on the face and head. Bleeding Weizhong, bladder 40, the Hexi point of the foot Taiyang meridian, can eliminate the qi stagnation in this meridian. It is good for furuncles on the back. Check along the spinal process for eruptions and furuncles and puncture 2 to 3 of them with a thick needle. The treatment is given once a day. This is also very effective. The needle embedding therapy in the due meridian is very effective. Take 3 long and thick sterilized needles and puncture subcutaneously from Shenzhou, due 12, to Shendao, due 11. From Shendao, due 11, to Lingtai, due 10, and from Lingtai, due 10, to Zhiyang, due 9. Fix the needles with adhesive tape. Retain the needles in this way for 24 hours. It usually requires only one treatment for healing. Hemorrhoids. Hemorrhoids is an anal disease caused by the varicosity of the anal subcutaneous veins with such symptoms as swelling pain, itching, suppuration, or bleeding. To treat this disease, locate Changqiang, due 1, Huiyang, bladder 35, Siliao, bladder 32, Changshan, bladder 57, and Arbai extra point in the region. All the points are punctured with a reducing manipulation. After acquiring qi, retain the needles for 30 minutes. Apply manipulation every 10 minutes. 1 or 2 treatments a day will be necessary. Changqiang Du 1 is the starting point of the Du meridian. It lies proximal to the anus. It can be used to disperse heat and cool blood, so it is an important point for treating hemorrhoids. Huiyang, bladder 35, eliminates blood stasis and stops pain. Siliao, bladder 32, eliminates the mass and relieves swelling. Changshan, bladder 57, can be used to treat hemiphasia and proctoptosis. Huiyang, bladder 35, Siliao, bladder 32, and Changshan, bladder 57, all pertain to the bladder meridian of the foot Taiyang. Because these divergent meridians intersect one another at the anus, while used in combination with Changqiang Du 1, the 3 points can promote qi circulation, remove stagnation, eliminate damp heat, and relieve the hemorrhoids. Arbai, extra point, is an extra point particularly effective for hemorrhoids accompanied by tenesmus, itching or pain, or bleeding proctoptosis. The prolonged prolapsing hemorrhoid is caused by the deficiency of qi. Locate Bai Hui, Du 20, Shen Xue, Ren 8, Ge Guan, bladder 46, and Guanyuan Shu, bladder 26. Puncture once daily. 10 treatments constitute 1 course. Applying Moxibustion at Bai Hui Du 20 for 10 to 15 minutes can activate the yang qi. Xuan Que Ren 8 is covered with a piece of ginger. Moxibustion is applied for 5 to 10 minutes. It can warm and activate the source qi and strengthen the antipathogenic factors. Bai Hui Du 20 can reverse the prolonged hemorrhoid. Ge Guan, bladder 46, is the door of the qi and blood on the back and is very effective for treatment of all blood deficiency syndromes. Ge Guan, bladder 46, should be punctured cautiously to avoid injuring the lungs. Guanyuan Shu, bladder 26, where the source of qi circulates, is an important point for treating the qi source deficiency. Its branch connects with the anus, so puncturing it not only can regulate the meridian and stop pain, but can also cure the prolapse caused by qi deficiency. These 2 points should be punctured very cautiously. Retain the needles for 30 minutes. Pricking the back is very effective. First, look at the hemorrhoid points on the back. They are reddish papules. Prick 1 or 2 of these hemorrhoid points with a thick needle, and then squeeze some blood and fluid out. The treatment is given once every 7 days, and usually 2 to 3 treatments will cure the disease. Mastitis. Mastitis is a kind of common purulent infection which often appears in breastfeeding women, especially the primipara. The manifestations of the diseased breast are redness, swelling, and burning pain. The mass may be palpable. There may be a disturbance in the milk flow system, discomfort, or alternate attacks of chills and fever. In the severe case, the mass of the breast may even be enlarged and reddened. The patient may suffer from throbbing pain and be susceptible to high fever. In the early stage, Chinese green onion or garlic, which has been chopped, can be applied on the diseased area. Moxibustion is applied for 10 to 20 minutes, 1 or 2 times daily. A good curative result can be achieved. The breast is on the stomach meridian, and the nipples are on a distributary of the liver meridian. Treat Rugan, stomach 18, Danzhong, Ren 17, Zusanli, stomach 36, and Tianjin, gallbladder 21, which are all applied with the reducing method. Retain the needles for 20 to 30 minutes. Treat 1 to 2 times daily. 7 treatments constitute 1 course. Rugan, stomach 18, is directly below the nipple in the 5th intercostal space. Puncture obliquely 0.5 to 1 cun to activate blood and stop the pain. Danzhong, Ren 17, near the breast, is one of the 8 influential points. Being the qi assembling point, it can regulate qi and remove obstruction from the collaterals to promote milk flow. When puncturing, it is advisable to first puncture obliquely 0.5 cun, rotate the needle, then lift and insert 0.5 cun again to the diseased breast to create a numb sensation in the diseased area. Zusanli, stomach 36, the He-Si point of the stomach meridian of the foot Yangming, can clear away heat and toxicity from the Yangming meridian to relieve the distension of the breast. Jinjing, gallbladder 21, where the foot Yangming and foot Shaoyang meridians meet, is the specific point for mastitis. It is capable of eliminating heat, distension, and relieving swelling and pain. When this point is punctured, the needle should be inserted obliquely about 1 cun, vertically and not too deep. If milk flow is not smooth, Shaozi, small intestine 1, may be punctured to cause bleeding. For liver qi stagnation, add Qimen, liver 14, and Xingjian, liver 2. Qimen, liver 14, is the mu point of the liver. Puncture perpendicularly 0.5 to 0.8 cun. It can relieve the liver depression and pain. Xingjian, liver 2, the yin spring point of the liver meridian of the foot Jieyin, is punctured to relieve qi stagnation in the meridian, disperse accumulation, and relieve pain. For the patient with fever, Dazui, Du 14, and Chuchi, large intestine 11, are needled. Dazui, Du 14, the hub of all the yang meridians, functions better in dispersing heat. Chuchi, large intestine 11, the He-Si point of the large intestine meridian of the hand Yangming, is full of qi and blood and can be punctured with a reducing method to expel heat and stop the pain. A special method for mastitis is to puncture Gao Huang, bladder 43, with a 3-edged needle. Cup it right away. Retain the cup for 20 minutes. There will be a little bleeding. Repeat the treatment the following day if necessary. Appendicitis. Appendicitis is a kind of inflammation of the intestines. In the chronic case, there is vague pain in the right lower abdomen. In the acute case, there are aversions to cold, fever, nausea, vomiting, and pain around the umbilicus, which will affect the right lower abdomen very quickly and will be aggravated when pressed. Hence, the patient will often have to stay in bed with the right leg bent. Points are selected mainly from the stomach meridian of the foot Yangming. Tianshu, stomach 25, Zusanli, stomach 36, and Lanwei, extra point, are punctured with the reducing method. Retain the needles for 60 minutes after the arrival of qi. Manipulate the needle every 20 minutes, 1 to 3 times daily. Puncture Tianshu stomach 25 perpendicularly, 1 to 1.5 cun on both sides. This point belongs to the stomach meridian. As the front mu point of the large intestine meridian, it can regulate the qi of the fu organs, relieve swelling, ascend the clear, and descend the turbid. Zusali, stomach 36, is the he C point of the stomach meridian of the foot Yangming. Puncture it vertically 2 to 3 cun. It can regulate the qi of the intestine and stomach, remove stasis, and relieve pain. Langwei, extra point, is a specific point for appendicitis. It can relieve pain and clear heat. Puncture it perpendicularly 1 to 1.5 cun. Retain the needle a little longer so a better result may be achieved. For distension of the abdomen, add Qi Hai Ren 6. For vomiting, add Neguan Pericardium 6. For fever, add Qu large intestine 11. And for constipation, add Fujie spleen 14. In the early stages of this disease, indirect moxibustion may be applied with a slice of raw garlic placed over the acupuncture point. Warm with a moxicone for 10 to 20 minutes. Treat 1 to 2 times daily. Stiff neck. Stiff neck is often caused by poor head position in bed or bearing too much weight on the shoulder. The neck is often immobilized. Local tenderness is evident. Treatment. The main points are Houxi, small intestine 3, Xuanzhong, gallbladder 39, and Luozhen, extra point. Houxi, small intestine 3, is the point of the small intestine meridian, which runs through the lateral part of the neck. Puncture it 0.5 to 1 cun or 2 cun towards Hegu, large intestine 4. Tell the patient to move his neck during puncturing. In this way, the pain may be reduced. If the curative result is not satisfactory, puncture Xuanzhong, gallbladder 39. Xuanzhong, gallbladder 39, pertains to the gallbladder meridian, which runs through the posterior part of the neck. It can remove obstruction from the meridians and collaterals and regulate qi in blood to relieve the spasm and pain. Luozhen has proven to be an effective point. It is proximal to the head of the second and third metacarpal bone on the outer side. Puncture it 0.5 to 1 cun. Retain the needle for 15 to 20 minutes. When the acupuncture is finished, apply Moxibustion at the affected site for 20 minutes until the skin becomes a little red. It may warm the meridian, remove the obstruction from the collaterals, activate blood, relieve pain, and promote recovery. Sprain. Sprain is a kind of soft tissue injury involving skin, muscle, tendons, ligaments, or vessels by an external force. The clinical manifestations are swelling, pain, and motor impairment, which often appear in the shoulder, elbow, wrist, lumbus, knee, and ankle. Locate points corresponding to the meridians and treat with a reducing method. Retain the needles for 20 to 30 minutes. The treatment is given once daily. 7 days constitute one course of treatment. For sprained shoulder, locate Jianyu, large intestine 15, Jianzhen, small intestine 9, Jianliao, sanjiao 14, and Ququ, large intestine 11, which is the point along the related meridian. Jianyu, large intestine 15, is punctured 1 to 2 cun towards the axillary fossa. Jianzhen, small intestine 9, is punctured 1 to 2 cun perpendicularly towards the interior. Jianliao, sanjiao 14, is punctured 1 to 1.5 cun towards the shoulder joint. Ququ, large intestine 11, is punctured perpendicularly 1 to 1.5 cun, which when combined with the above-mentioned points can remove obstructions from the meridians and collaterals and promote the healing of the shoulder. For sprained elbow, locate local points Ququ, large intestine 11, Tianjing, sanjiao 10, and Xiaohai, small intestine 8. Waiguan, sanjiao 5, is the point of the corresponding meridian. Ququ, large intestine 11, is punctured perpendicularly 1 to 1.5 cun. Tianjing, sanjiao 10, is punctured perpendicularly 1 to 1.5 cun. Xiaohai, small intestine 8, is punctured perpendicularly 0.5 cun. And Waiguan, sanjiao 5, combined with Ququ, large intestine 11, Tianjing, sanjiao 10, and Xiaohai, small intestine 8, is punctured perpendicularly 1 to 1.5 cun. It is quite effective in treating elbow sprain. For wrist sprain, locate local points Yangxi, large intestine 5, Yanggu, small intestine 5, and Yangshi, sanjiao 4. Locate Ququ, large intestine 11, as the corresponding meridian point. Yangxi, large intestine 5, is punctured perpendicularly 0.5 to 0.8 cun. Yangshi, Sanjiao 4 is punctured perpendicularly 0.3 to 0.5 cun. Yanggu, small intestine 5 is punctured perpendicularly 0.3 to 0.5 cun. Qu, when combined with the above-mentioned points, can disperse the accumulated swelling, remove obstructions from the collaterals, and promote healing of the wrist. For low back sprain, select Shenshu, bladder 23, and Dachangshu, bladder 25 as local points. Select Weizhong, bladder 40 as the distant point. Shenshu, bladder 23 is punctured perpendicularly 1 to 1.5 cun. Puncture Shenshu on both sides. Dachangshu, bladder 25 is punctured perpendicularly 1 to 1.5 cun on both sides. Weizhong, bladder 40 is punctured perpendicularly 1 to 1.5 cun. Yao Tongdian, extra point, is quite an effective point for acute lumbar sprain. Puncture 1 cun towards the palm center with periodic manipulation. Tell the patient to move his waist. A good curative result can often be achieved. For knee sprain, Xiyan, extra point, and Xiyangguan, gallbladder 33, are the local points. Zusanli, stomach 36, is the corresponding meridial point. Xiyan, extra point, is punctured perpendicularly 1 to 1.5 cun. Xiyangguan, gallbladder 33, is punctured perpendicularly 1 to 1.5 cun. Zusanli, stomach 36, the He point of the stomach meridian, when combined with Xiyan, extra point, and Xiyangguan, gallbladder 33, can remove obstructions from the collaterals and relieve swelling and stasis. For ankle sprain, select Kunlun, bladder 60, Qiushu, gallbladder 40, and Jiexi, stomach 41 as local points. Select Zusanli, stomach 36, as the corresponding meridian point. Puncture Kunlun, bladder 60, perpendicularly 0.5 to 0.8 cun. Puncture Qiushu, gallbladder 40, perpendicularly 0.5 to 1 cun. Puncture Jiexi, stomach 41, perpendicularly 0.5 to 1 cun. Zusanli, stomach 36, when used in combination with the local points Kunlun, bladder 60, Qiushu, gallbladder 40, and Jieshi, stomach 41, is quite effective for treating ankle joint sprain. Psoriasis. In the early stages of this disease, small prevalent eruptions appear and are light in color. They gradually become enlarged and appear like patches of pine tree bark. For treatment, the main points are Qu, large intestine 11, Xuehai, spleen 10, Sanninjiao, spleen 6, and Geshu, bladder 17. The reducing method is applied. Retain the needles for 20 to 30 minutes. 7 days make one course of the treatment. Generally, 3 to 5 courses are sufficient. Qu, large intestine 11, the He point of the large intestine meridian, is rich in qi and blood. Reducing it can disperse wind heat. Xuehai, spleen 10, the point of the spleen meridian, is the main point for treating blood syndromes. Reducing it can activate blood circulation, remove stasis, clear heat, and harmonize the blood system. Sanninjiao, spleen 6, where the foot Taiyin, the foot Jueyin, and the foot Shaoyin meridians meet, belongs to the spleen meridian. It can nourish yin, strengthen the spleen, and eliminate dampness. Geshu, bladder 17, is the influential point of blood and pertains to the bladder meridian. Puncture it obliquely 0.5 cun. It can regulate blood and nourish the skin. Tap the diseased area with a plum blossom needle. First, tap the back besides the spinal column along the bladder meridian 3 times, then the diseased areas to cause a little bleeding. Mumps. Mumps is an acute epidemic disease commonly seen in the winter and spring in children between 5 and 9 years old. The signs are a thin white and slightly yellow tongue coating, and the pulse is vague and rapid. Points along the meridians of the hand Xiaoyang and the hand Yangming are indicated as the main points. For treatment, Jiache, stomach 6, Yifeng, Sanjiao 17, Hegu, large intestine 4, and Waiguan, Sanjiao 5 are selected. Jiache, stomach 6, is horizontally inserted to 0.5 cun. Yifeng, Sanjiao 17 is inserted 1 cun downward. It can dredge stagnated qi and blood in the local area. Hegu, large intestine 4, has the function of dispelling wind, relieving the exterior, promoting circulation of the collaterals, and checking pain. Waiguan, Sanjiao 5, functions to relieve the exterior, clear heat, and promote circulation of qi and blood. For difficulty in chewing, add Xiaguan, stomach 7. The above-mentioned points are punctured with the reducing method. The needles are retained for 20 minutes after the arrival of qi. The treatment is administered once a day for 3 to 5 consecutive days. For fever, add Dazui, Du 14. For swelling and pain in the testes, add Quchen, liver 8, and Taichung, liver 3. Burning rush moxibustion is a kind of effective method for mumps. First, crop the hair short over Jiao Sun Sanjiao 20 on the affected side. Take a rush pith and put a little oil on it. Ignite and touch Jiao Sun Sanjiao 20 and remove it immediately. Generally, one treatment will be effective. If not, the procedure should be repeated the following day. Herpes zoster. Herpes, or herpes zoster, is an acute virus-caused dermatosis. In the initial stage, there is a burning sensation and stabbing pain in the skin. In the local area, the skin is reddish. Afterwards, there will appear gathered herpes, which rapidly turns into blisters. The blisters are usually in a cluster, like a belt surrounding the waist. Treatment: Chuchi, large intestine 11, and Weizhong, bladder 40, are the points to treat herpes zoster. Chuchi, large intestine 11, is punctured with the reducing method. Retain the needle for 20 to 30 minutes. The treatment is given once a day. Weizhong, bladder 40, is pricked to bleed a few drops of blood. For excessive heat in the liver and gallbladder meridians, add Taichung, liver 3, the yin source point of the liver meridian of foot Jieyin. In addition, needle Zhigou Sanjiao 6, the Jing river point of the Sanjiao meridian, to clear fire in the liver gallbladder and Sanjiao. Both of these points are punctured with the reducing method. Retain the needles for 20 to 30 minutes. Apply manipulation every 10 minutes. For excessive dampness in the spleen and stomach, the symptoms are characterized by reddish skin and partially filled blisters. Add Zhu Sanli, stomach 36, the He-Si point of the stomach meridian, with reducing manipulation and retain the needle for 20 minutes to reduce the Yangming heat. Add Sanyinjiao, spleen 6, the meeting point of the 3-foot meridian, with the reducing method. Retain the needle for 20 to 30 minutes. Apply manipulation every 10 minutes to dispel the Taiyin dampness. For the local region, treat with the needles surrounding the affected area. Puncture around the herpes zoster about 0.5 to 1 cun. Locate points according to the dermatosis area. The best distance between needles is 1 to 2 cun. Puncture perpendicularly or obliquely with the needle tip pointing to the center of the herpes. When a slight sensation of soreness, heaviness, numbness, or distension is felt, retain the needles for 20 to 30 minutes. One treatment a day is required.
Yi路漫漫，披迹相伴。